everyone. Welcome back. I'm Carson Porter once again here on Common Sense. Today what we're going to talk about is a little something I like to call the Obamacare, obamascare. I want to talk about what Obamacare really is. Is it good? Is it bad? So on and so forth. I think it's absolute atrocious evil, but we all have our own opinion about that. But I'd like to make my argument why. First of all, for starters, Obamacare is a healthcare reform plan that would provide statutes which require everyone residing in the United States to have insurance, to have health insurance. If you do not have health insurance, if you cannot purchase health insurance, or you decide not to purchase health insurance will be provided to you through the government. And obviously, I'm sure they'll have their own contract with private insurance companies to give out government insurance, such as AARP, so on and so forth. What this means is that no longer will anyone have the problem of unaffordable hospital bills, of being turned down at the hospital because they can't pay for something, because everyone will have insurance. I want to look at some of the problems this creates, though, the real life problems this creates. So, like I said, it's been advertised in a huge way to the lower income level citizens and residents of the United States. And why? Because those are the ones, obviously, that generally cannot afford it, or do not have money to pay for those things out of pocket and do not need it. So let's look at this objectively. Let's say I'm a small business owner. Okay. Let's say that as a small business owner, my profit margin isn't very big. We're barely scraping by as it is. So when I hire my employees, I pay them well and I treat them decently, but I have them all opt out of further insurance plans beyond what the state and federal government already requires, i.e. workman's comp, so on and so forth. After that, now that Obamacare has been passed, I guess I should say, Obamacare doesn't require me to purchase insurance for my employees as a business owner. What it requires me to do is provide insurance for my employees. I don't have to buy it. So now that I can't afford to buy it, now the government is going to go ahead and just issue me an insurance policy, and that insurance policy will cover all my employees. But the way the Supreme Court and Justice Roberts went ahead and passed Obamacare states that it is constitutional as a tax, which means that the government cannot just force me to have insurance, and they cannot force me to go out and pay for insurance. What they can do is tax me and give me insurance based on those taxes. So back to the point, I can't afford to get private insurance anyways. So now the government issues me a policy, then they turn around and tax me for that policy. And I'm supposed to pay this tax with what additional income? I'm just wondering. Maybe someone from the Obama administration, or someone who really understands this, could give me a call and help me out. I would appreciate it if I'm just missing something. But as far as I'm aware, if I don't have $2 to go buy some Wonder Bread for my kids' sandwiches, how the hell am I supposed to buy lunch meat for those sandwiches? That's all I'm wondering. If I don't have $2 to put down on private insurance, what makes Uncle Sam think I have $2 to pay a tax for government insurance? This is asinine. It's retarded. So, and not retarded in a politically incorrect way of thinking. Retarded in the sense that it is a severely setback way of thinking. It's severely set back. What this means now as a business owner is I can't do this. I can't be in business. I don't qualify because I can't meet these statutes. I can't pay for them, so on and so forth. So now I go out of business. What does this mean for my employees? Let's say they're all low-level income employees. What they were making barely got them by. Now they're not making anything. All the economic welfare generated by the job that they had is now gone. Which is funny in and of itself, because one of the biggest pushes on the liberal ticket is that, they're out there doing everything they can to create jobs. Obamacare destroys jobs. It gives jobs away. They're gone. They're just nullified. They're no longer in existence because of Obamacare, and that will soon come to pass. Should come this fall, nothing happen to overturn some of the issues with that. So now all these employees, they don't have that economic welfare that they were generating there. And obviously they don't have insurance because I'm not providing it for them. So now they're still required to have insurance. So now the government's going to go ahead and issue them an insurance policy and tax them for it. Tax them from what money? Because now they don't have a job. So now the government's going to go ahead and cut them a welfare check and then tax them back for their health care. So where does this money come from anyways? Because obviously now these people aren't contributing anything to the cycle. Now, let's say John Doe down the street still has a job. He's got health care, so on and so forth, and he's paying his taxes. Now because Jane up the street lost her job because her boss couldn't afford to pay taxes or pay additional taxes or to purchase her an insurance policy. Now Jane is going to be given her welfare check, created by, in portion, the taxes that John is paying. Okay, and John is going to pay for her food, and now he's also going to pay for her health care, which I guess is just it's one more straw on the back of an overladen man, and that man is in this country at this moment the middleman. It's not the rich that carry this tax. You want to talk about a redistribution of wealth? Break up Microsoft. Tell the Obama administration, Obama has raised how many millions? Hundreds of millions, over $200 million for his campaign election. Governor Romney's done the same thing. Not Governor Romney, Senator Romney, I'm sorry. Millions of dollars. For what? For TV ads and for... Why not do the right thing? Give that away. Put that back into the system. No. You don't care. It's all about your agenda that you're pushing, and that straw is going to go on the back of the middleman. It's not going to go on the back of the rich. Let's be honest about this. The rich control things, and therefore they're not going to do something that weighs them down anymore. They want to further the disparity between them and the common man. Why? Because that brings wealth and power and so on and so forth. Okay. So, Obamacare, it's scary bad stuff for everyone. Except for, I guess, those who are uber rich and who are in charge. But it is a scary situation for the middleman, because as a middleman, hypothetically speaking, now I don't have to just support me and my family, I have to support my neighbor and his family on the same job, getting the same wage, only a little less wage now, because now the government's going to tax me for healthcare reform, or for healthcare, unless I just go and purchase healthcare. And even if the government taxes my employer, that tax won't stay at my employer. That's rule number one of economics. If you have, as a business, if you have an additional cost, you pass it on, or at least part of it. So now with less income, I have to pay for two families instead of one. That doesn't seem fair to me. How does that seem equitable? Okay, it doesn't. So, point is, behind Obamacare, it's like I said, a severely setback way of thinking. It hasn't been thought through. The only thing that has been thought through about Obamacare is that I guess maybe it's a good way to make several people rich. Obviously, there's several other issues with Obamacare where our health care, the quality of our health care will go down substantially because there's no competition in the market. A doctor's going to get paid what a doctor's going to get paid. We've all heard these arguments over and over. My job is to bring forward the arguments that we don't normally hear. This video isn't for the man who's going to go see the doctor. This video is for the people who aren't going to go see the doctor because Obamacare is not going to pull through. It's not going to work. If I lose my job and I still have to have health care, John up the street is not going to be able to feed his family and mine and pay for my hospital bills. It's just not going to work like that. This country will fall and it will crumble, and when it does, we will have Obamacare to blame. So, anyways, feel free to leave your questions, comments, anything you like or dislike. I appreciate it. Appreciate everybody listening, and think about it. What's common sense? What's not?